Great effort.
Great. And I remember when I first stepped into a psychiatric unit, after that day, I never went back until close to was the stigma, number one, that is related to mental illness. Number two is the lack of awareness. For example, I've been asking around in Yoruba culture, which is part of the West, that's the most popular language in the western part of Nigeria. There's actually no exact word for depression. And so also in some other countries, there is no word for depression.
Everything is weird.
Now, wherever your come is sadness. But in terms of depression itself, there is no actual word because it is not, in quote, a culturally acceptable condition. In African culture, if you tell, or in Nigerian culture or country, if you tell someone you are depressed, they will say, get up. Now, I'll speak a bit of language to drive the word home. And they will say, what is wrong with you? Get up, you are not the only one that, has lost your child, or you are not the only one that has lost your job, you are not the only one that has done this, you get up and, get on with life. It happens to everybody. And it's cultural. And especially with depression, where reclusion and hiding into your shells is one of the key factors. When you say that, and self-esteem is very low. We all know in patients who are depressed, self-esteem is very, very low. And then you're telling that person, get on with your life, with that, you've shut the door. Now, the question really is, that's the preamble to the answer. Now, what we could do, and what, the Royal Highness, who is present amongst us, and I'm quite impressed that he actually came, is to educate our people. Now, it is a shock to me that in Africa and in Nigeria, there is little or no primary health care service or delivery system. Yeah, there is little. There's none. There is little. Because I'll now give examples. For example, in Ife, in Lefe, the secondary care service is in Elisha. You have some primary delivery services, but the main ones are the tertiary services that we have. In Lagos, I'm aware of a project which was done with, what's it called, with LASU.
No, you see, what is happening is different. We have the primary health care centers, right? What you should be saying is that it is inadequate.
Yeah.
Not that it doesn't exist. It exists.
What I said is there's little.
Okay, because
it's not enough. It's not enough. And that's the fact.
Again, not just that it's not enough or inadequate, right? They don't even know what to do because what they believe the primary healthcare center is maternity and first aid. And that's where it ends. You see, so what you're suggesting and what he's hoping to, I think, for an answer is a situation whereby the traditional rulers are the closest to the grassroots. Just like Dr. Kalpana said earlier on in a delivery, even the Bible does not have the word depression in it, but it's clearly the situations she narrated were clearly situations of depression. So what we're doing now is to now culture evolves, tradition evolves, except in Africa. That's the truth. There are certain things, for instance, there are certain things you do that will give you a headache. What is the solution? Take Panadol? Yeah, but here you will do rituals. You see, this, you would have to carry out rituals. What am I trying to say? The culture, we are in a very, very dynamic period of existence. And a lot of things need to be redefined.